Okay, thank you everyone for showing up on a beautiful Sunday afternoon. My name is Kate Titus. I'm the owner and founder of Loyal Companion. Thank you for joining us today. I'm very, very excited to have Dr. Shubitz with us today. She has been an amazing warrior and pioneer in the study of valley fever. She is a research scientist at the Valley Fever Center for Excellence at the U of A and has been there since 1996. So she's been in this battle a very long time. She's also was honored with the Women of Impact Award this year, which is given for mentorship in innovation and contributing to the general mission of the university at the U of A. So that is a huge honor. So Dr. Shubitz is going to be talking for somewhere between maybe 50 minutes and an hour-ish, and then we're going to leave time at the end for questions. When you have your questions, please state those clearly, and if you can, just give us.
Try to repeat it.
Yeah, just repeat a little bit so everybody at home can hear. Okay, here we go. Thanks, everybody.
Well, good afternoon. The title speaks for itself. So the technical name for valley fever is coccidioidomycosis, and you can't leave here unless you can say that. I could make you spell it, but we want to go home. So we're going to talk about this disease in dogs. And first of all, what causes it? It is a fungal disease as opposed to bacterial or viral. Funguses have increasing importance as causes of disease in our world, and so you probably have all become relatively familiar with invasive fungal infections and opportunistic fungal infections. This one grows in the soil, and it grows in our soil in spite of our beautiful sunsets that you can see on that screen. And our lovely saguaro cactuses, beneath their feet grows this insidious little bug. And it releases its spores into the air. And the picture down below here is a picture of what the spores look like under a microscope. They're barrel-shaped little arthoconidia. They're very tiny, and they're easily inhaled into the very deep parts of the lungs. And both animals and humans get disease from valley fever, but we are not all equally susceptible in terms of either species or even individuals. We won't go into that too much. But like cows don't get sick. They get it, but they don't get sick. Dogs get sick. So where do we find it? So we already know it lives in Arizona. It's endemic to a lot of the American Southwest, and this is a CDC map that was produced in 2023. And what shows on this map, well, it doesn't show nearly as well on yours. I think you can see this, is that this orange gold area here are the places where they really know it exists. They see cases. And this cross-hatched area are areas that, because of the warming and drying of the climate in the western United States, they predict, and there is some evidence, some actual evidence, that it is moving into these areas, that it could cover most of the western United States through the Dakotas and even eastern Texas by the end of this century. So we'll talk about where it is now, though. And the majority of the cases occur in California and Arizona, with, in humans, Arizona a little bit more overrepresented than California is, because California's had so much wildfire and drought in the last 15 years that they now account for about 40% of the cases that occur in humans that are reported, whereas they were down around 20, with Arizona accounting for at least 60%, more like 70%. These other states, Nevada, Utah, New Mexico, and Texas, have many fewer cases. It knows no borders. It occurs in Central and South America and Mexico. Below us in Mexico, it's just as hot as it is hot for valley fever, as in endemic, as it is here. But the single highest number of cases in humans and animals occurs in Pima, Pinal, and Maricopa County in Arizona. So we live in the epicenter of valley fever. It doesn't help that there are, 6 million people and all of our pets living here. This other area over here is Bakersfield, Tulare County, Kern County, and there simply aren't as many people over there. Let's see. Oh, there's a note here that at least 70% of the dog cases occur in Arizona. We've got some new data that's almost ready to publish that suggests it's actually closer to 90. So the split in the incidence in dogs and human cases is highly more variable in California than it is here, where they parallel each other pretty well. So who gets it in terms of animals? Dogs are bolded here because we're going to talk about them today, but also they account for the vast majority of clinically important valley fever cases that occur in animals, and that means it affects a person's pet, and they have to take them to the vet and pay for it. So cats do get disease. They don't get as much disease. They are often very sick by the time they show up at the vet and get diagnosed. Llamas and alpacas, which is a group are referred to as South American camelids, are also extremely susceptible to this disease, and they very readily die of disseminated disease. And we have at the Valley Fever Center done a little bit of work to help llamas and alpacas too by working on fluconazole doses that would be potentially therapeutic. And then we have several zoos within the endemic area, and that includes California. And among the zoo animals, primates are probably overwhelmingly the most susceptible. And there's a picture of a gorilla here. This is the Tucson Zoo's gorilla from before my time, actually, probably. This is one of our lovely little alpacas that was willing to participate in our research study. And but these guys die, and they don't. The zoos spend astronomical amounts of money treating valley fever in the animals that we have in our, in our zoos, and also San Diego, Los Angeles. They have a gorilla in the Los Angeles Zoo right now that takes $38,000 a year worth of valley fever medication. Yeah, and then we do see it in native wildlife. The actual impact on native wildlife is very difficult to measure, but it may be an incidental finding in a carcass that was picked up for another reason, but it can occur. So how do we all get it? How do dogs get it? Nearly all the infections are inhaled for the reasons I explained on the first slide. The spores are in the soil. They get dispersed into the air with disruption of the soil, wind, digging dog, people running ATVs or hiking. I mean, it can be almost anything. And the risk factor is breathing. And I already mentioned that cats can get this. We see this in totally indoor cats. So the spores are in the air. They get into our air conditioner systems. They come in on our shoes and our pants. It's not avoidable. We cannot live in a HEPA-filtered bubble. The disease is here, and we get it by breathing. Dogs have behaviors that probably make them more likely to get it, and also more likely to be exposed to a higher dose of the spores when they do breathe it in. And those are their digging behaviors, sniffing in the soil, looking around things. It is more commonly seen in dogs that hunt or run in the desert. They have a lot of property to roam on and do dog things. And they probably breathe in more dust than your average couch potato like mine that spend 10 hours a day lying on the couch, and the rest of it in my graveled backyard. So there is also a very strong association with rodent holes. The rodents and their holes provide an excellent environment for the fungus to live when it's not infecting a dog or a human. So in some sense, we're probably a little bit incidental, because if all the humans and all the dogs left this country tomorrow, valley fever would continue to exist in this, what we call a sylvatic life cycle, with the native population that lives in the dirt, and all the things they live with down there would keep this going very well. So one question I get asked a lot by clients, and sometimes by veterinarians, is it contagious? And dogs and people can both get valley fever, but it is not considered contagious from one to the other. Your coughing dog is not going to give you valley fever. You and your dog may have gone for a walk and breathed in spores together, and got sick, but you didn't give it to your dog and your dog didn't give it to you. So the spherules, which is the part of the life cycle that's in the host, and I took the slide out to save time, don't transmit very well from animal to animal or animal to human. There's one exception in the literature. A veterinary technician got bitten by a cat with draining valley fever lesions inside the cat's mouth. And it was basically a direct injection type of infection, and that person became sick. But it is not normally contagious from pet to pet or pet to human. And again, it's got to go back into the soil and make its spores that you then breathe in. So how do we know our pet might have valley fever? So this list of clinical signs and symptoms is a list of the most common things. It can present almost any way because it can go so many places, and the symptoms can sometimes be really vague. So most dogs come to the veterinarian with some kind of a chronic cough. The cough, it's coughing and it won't go away. Maybe it's even been on an antibiotic and it still won't go away. But veterinarians in Southern Arizona are very hyper alert to the whole valley fever thing. And your dog isn't going to have to go on with this very long normally before someone will order a test for the valley fever. The signs can also be more vague. They may not cough. They may just run a fever that comes and goes. Lack of energy is a really common reason why the dog is brought to the vet. The owner comes and says, my dog is just not itself. You know, he won't play with his toys. Or I threw the ball for him twice and then he didn't want to chase it anymore. And usually these are younger dogs. You know, it's not like it's a 14-year-old dog with arthritis who won't chase the ball anymore. It's their 8-month-old lab puppy. So, and then they don't eat. Often when they don't eat, it's because they have a fever, but not always. They feel bad and they lose weight. Weight loss that's usually not commensurate with the amount that they're not eating. They're losing weight faster than just the reduced calories because they're really picky and don't want their dry dog food would account for, because they are in a hypermetabolic state from this systemic illness. So the most common presentation of valley fever is fungal pneumonia, cough, fever, lethargy, lack of appetite, plus minus weight loss. And some dogs, all they do is cough. They're not really running fevers. So, and most people bring their dog to the vet for these things. So the valley fever can also behave very badly. It can get out of the lungs quite easily. And this is called disseminated infection. It means it went someplace other than where it came in the lungs. And when I talk about in the lungs and not disseminated, this includes the thoracic lymph nodes. And this is something that your veterinarian may say to you if you're getting lung x-ray for a dog that's got valley fever. It's like, oh, there's big lymph nodes in the middle of their lungs. And that is still considered part of the primary fungal pneumonia situation. Sometimes they have more thoracic lymph node swelling than they have abnormalities otherwise in the lungs, but they're coughing and not feeling well. The most common place valley fever goes outside the lungs is to the bones. And this is a bit species specific. In humans and in cats, it's actually the skin, not the bones. But in dogs, it is the bones. And it is more commonly the bones of the legs than the bones of the vertebrae or the skull. We see it once in a while in bones in the feet, but it's really most commonly the big bones of the legs and the shoulder. And I see a lot of vertebral cocci in what I do. It's usually, I see referral cases, and we may see more of that. It also can go to the brain. This is relatively common in humans, and it is the single most severe complication of valley fever in people. They require medication for life, and some of them die in spite of it. That can be true of dogs as well, but if it's caught and treated, most dogs actually do pretty well with this. More than half of dogs with valley fever in the brain or the central nervous system present with seizures. So other signs are circling, falling, head tilt, dull mentation, they don't know who they are or where they're going. People would notice this and bring them in. And this I worked with a neurologist at V. Scott for 17 years, and I work with him again now at Tucson Veterinary Specialists. And we've done some digging into records and learned of these things like circling head tilt, encephalitis, so they may present like they have a headache, stiff neck, very dull mentation. And these dogs have valley fever. Their CSF taps are abnormal, etc. It does occur in the skin in dogs. It can be a primary sort of an abscess type thing, or sometimes it is a lesion that's draining above an infected bone that's below. And we used to think that most of those had a bone lesion underneath, but I see a lot of them that don't. They're just like a skin abscess. And then heart and pericardium. These are young dogs. They're usually under 5 years old. They come in and all of a sudden they're in heart failure. It's like, wow, that's weird. And they have the valley fever's infected the lining around their heart in most cases. And I have a picture of it on the next slide I'll show you. It's a sort of a worst case scenario. But these could actually be diagnosed by ultrasound. And when there's fluid between the heart and the lungs, it's actually still pretty treatable. When the pericardium starts to get very thick, it's about the thickness of a piece of Kleenex. It's very stretchy. It allows your heart to pump. And after the valley fever infects it, it fibroses or scars, and it can get very thick. And the heart can't pump against it, and that's why they come in heart failure. They can get fluid from valley fever in their thoracic cavity or in their abdominal cavity. These dogs may have difficulty breathing. Their abdomens may be swollen. Sometimes the owner says, well, when I pick her up, she cries because it hurts. So they may be painful, and they often have a fever. And the eyes, they can get valley fever in the eyes, or it can be a secondary immune-mediated reaction to the systemic infection. So they can get retinal lesions of the fungus actually in the eye. And these dogs may literally present with acute onset of blindness. It's like, my dog could see yesterday and today it can't. Or they may have pain, squinting, and redness and discharge, which may be noted like on their veterinary visit. But some dogs go to the ophthalmologist for this chronic eye problem, and the ophthalmologist looks, and I think your dog's got valley fever. And that's the first they know of it. And then they get a further workup. So disseminated cases typically are more serious and require longer treatment and more diagnostics than the pulmonary cases. Pulmonary cases can be very bad and resistant, but in general, disseminated is a tougher thing to treat. So this is an example of some disseminated cases. This is on your left here. You're right. This is a very characteristic bone lesion in a very characteristic place for valley fever. This is a vertebral bone lesion. And when the vet says, I think your dog needs a CT, and you go, what for? It's because sometimes vertebral lesions, and especially in the neck, can't be seen very well. But if you do a CT on them, they literally show up amazingly well. And you could say this really looks like fungal osteomyelitis. This is what happens to the pericardium when it scars down. This dog did die of heart failure. And the pericardium was up to 1 centimeter thick. That's almost a ½ inch thick in some places. This is a very old case. We didn't have as many drugs or as much awareness of this problem. And this dog was too far gone at the time, but there is a surgery to remove this, but it like removes all your savings too. It's really tough. I always feel bad for people because it's such an expensive surgery, but it's open heart surgery. And this is a brain lesion on an MRI. An MRI is really the single best tool by which to see brain lesions. And you see the lesion, you also see all the swelling around it, which is what makes them seizure. And this is a draining lesion with a bone lesion underneath. And this dog doesn't have a rib 7 and 8 on the right side because it was completely destroyed by valley fever. And when I first saw this dog, it was an animal shelter dog. It had like 3 draining lesions under its arm here, in addition to this one. on the shoulder. It had already had a whole bunch on the lower leg down here that had healed. So this dog had valley fever everywhere. These are very hard to treat, but she's still alive. So what do we do diagnostically if we suspect this? So you're probably going to get a recommendation from your veterinarian to run a complete blood profile, which includes serum chemistries and a complete blood count. And common changes on this include elevations in the total white blood cells, or in this one specific subset of blood cells called monocytes, which are mainly indicators of a chronic type infection, which is what valley fever is. And then on the serum chemistries, the primary changes are in the blood proteins. And globulin, again, is an indicator of chronic infection because the body's working so hard and pumping out antibodies and other kinds of immune proteins to try to solve the problem that the blood globulins go up and the albumin may go down. So and this is something that they're just going to tell you there's abnormalities and you won't have to deal with the details. The cocci-serology, or the valley fever blood test, or titer, it may often be called, when you go to the vet, is probably the most single basic confirmatory test for a dog where they suspect that it has valley fever. And without having to do definitive diagnostics like culturing things, a positive titer in a dog that's got characteristic clinical signs and, maybe lung x-rays and things like that is going to be pretty diagnostic for valley fever. It's possible for it to be confused with something else. But here in Arizona, these two things usually go together. And then x-rays, I tell people they're really important. It gives us something to monitor besides the titer, because the quantitative aspects of titers can be very problematic in terms of determining how sick the dog is, whether it's getting better, etc. And I have a personal story about that, but we probably won't have time to go into it. And usually what needs to be x-rayed is lungs and bones. So advanced diagnostics are the ones where you might have disseminated disease in a weird place, things aren't getting better, they've gotten worse. The diagnosis is confusing. It looks like another disease. And there are things, or you have a cat with skin disease. These kind of diagnostics are going to be employed. And this is a picture of a cytology where they actually put a needle in a superficial lesion and tried to take some stuff out of it, and they could see the spherules in the lesion. Well, this is diagnostic. You don't have to go any farther. You now know this is valley fever. Those don't belong in there. A surgical biopsy may need to be done. Occasionally, a culture would need to be done, though I expect they'd probably do that in Minnesota, not Arizona, actually, because they're not differentiating it from that many things out here. So these are laboratory tests on fluids and tissues. And then advanced imaging, which we've already briefly touched on, and that's CT and MRI. If plain x-rays are not showing it, or it's a central nervous system lesion, or even lungs. I have lungs where we can't see the hilar lymph nodes, and you do a CT on them and you can see that there are 5 of them swollen, not 0. So there are reasons to do advanced diagnostics. They cost more. I think people are judicious in recommending them for the most part. And ultrasound is really useful if you need to collect samples from abdominal organs or lungs. How do we treat it? That's the $1 million question, quite literally.
Yeah.
Okay, literally. So the thing about treating valley fever or any other fungal infection is it's not like taking an antibiotic for a bacterial infection where you're probably going to take an antibiotic for 7 days or 10 days or 2 weeks. Dogs are on these medications for months and sometimes years. It takes a long time to resolve it. Not just dogs, we're talking about dogs, but this is true of humans as well. This isn't unique to dogs. This is unique to fungal infections. So they're hard to treat. So the best news is your dog coughed for 2 weeks. You took it to the vet. They went, aha, I think you might have valley fever. They did a test and they started him on some medication. and took an x-ray of his lungs, and he's got the characteristic findings. And for 6 to 12 months, you give your dog this drug, and at the end of that, the lungs are all better, the titer's gone, and you go on with the rest of your dog's life and all of his walks. So uncomplicated disease usually takes 6 to 12 months to resolve. Uncomplicated lung disease. For the disseminated disease, where it's gotten out of the lungs, they're mostly a little bit harder to treat in general. And we're talking largely about bones. You're looking at about 12 to 18 months. And these uncomplicated bone lesions, one bone, one lesion, dog responds really well to the first medication it's put on, and the limping goes away in 2 weeks. In a year to a year and a half, this will be resolved. The titer will probably be really low, and they'll say, well, let's try him off the medication. So uncomplicated disseminated disease, you're looking at 12 to 18 months. Difficult cases that don't respond, or they come back, they have poor responses, the dog maybe has some other underlying problems. They may be on the medication for years and eventually get off it. And there are a few cases that will need lifelong maintenance. And we usually lower their doses and keep them on it because they've demonstrated that their immune system cannot control the residual fungus that's in their body. Antifungal drugs do not eradicate the fungus from the dog or the human. They kind of put it to sleep, and your immune response system is responsible for keeping that bug in check. And if it can't, there's going to be some requirement for a drug. So we don't have a ton of medication options. There's a class of drug that we nickname azoles, fluconazole, itraconazole. You see the pattern emerging. So azole is a type of a chemical structure, and that's why they get called that. And so the primaries are usually these azole drugs. There are 4 of them that are used pretty routinely at the moment. Terbinafine is a drug that we started using maybe 10 or 15 years ago as an add-on drug. It's like a booster drug. And it's used for salvage invasive infections in humans. And it looks like, and there's data, there's not a ton of data, but there's data that shows that it's synergistic or additive to fluconazole and itraconazole for even treating infections like valley fever. So one thing that can happen if a dog's doing pretty well on a drug, he's tolerating it well, but the response isn't really as good as everybody thinks it should be. Now we will add terbinafine to the dog. It's inexpensive. It doesn't have a lot of adverse effects in general. And it's really easy, and the owners don't really mind it. And they only have to give it once a day. They really like that. So, and then there's a drug called amphotericin B. It's the oldest drug we have to treat any kind of an invasive fungal infection, and valley fever specifically. It arrived about 1958. And it makes humans feel worse than valley fever. They call it amphotericin, but this drug saves dogs' lives. And but it's very expensive. It's very expensive to give to a dog. It's a series of infusions, and you're still following up with oral medication for months or years. So we use it for life-threatening disease. And then, so I've talked a little bit about adverse effects. The azoles as a class have a host of them, and not every dog will develop them. And some dogs develop none at all, but they're things that owners and veterinarians need to keep an eye on. The big ones with the azoles: nausea, vomiting, diarrhea, lack of appetite. These are the ones that we most commonly deal with. And we can do appetite stimulants, we can lower doses, we can switch the drug, we can have you feed special food that the dog loves. There's a lot of things that can be done. And they can elevate liver enzymes. Except for fluconazole, they're all completely processed by the liver. And fluconazole is about 10 or 20%. The rest of it's excreted by the kidney unchanged. And but it can bother the liver, and it does bother the liver, to the point sometimes we actually have to take dogs off it. So you monitor everyone. I treat everyone like they could have a liver problem from these drugs. And then there's some weird things: elevated potassium, low potassium, allergic diseases, skin side effects, etc. We're going to go through a few of them. Poor responses are a big problem, especially with fluconazole. And then laboratory monitoring needs to be done. And this tells us, one, your dog may be getting better on the medication if white blood cell counts go down. Two, their liver is tolerating this drug, or it's mostly tolerating this drug, or gee, we're worried and we need to test it again because if this goes up anymore, they really can't take it. We're going to have to make another choice. So laboratory monitoring is really important. And when your veterinarian recommends it, they're not just trying to separate you from your money. They're doing it to try to keep your pet from having a big problem with this drug down the road. I think twice in 20 years of doing this, I have seen a dog come in and outright liver failure from a nasal because nobody looked. It was preventable. They don't get liver failure tomorrow. They get liver failure because they've been on it for a long time and nobody noticed that, oh, by the way, the liver enzymes were through the roof. So monitoring is important, and they'll give you a schedule. So fluconazole, I've already mentioned, is the most commonly prescribed drug, and that's for humans and animals. It's really well absorbed, and this is one of the reasons why it's used so much, is it's easy to give for people to give to their pets and not have to worry about whether or not they're eating. And it's also really inexpensive. It's generic. It's been generic for a long time. And it's pretty cheap, considering you have to give it for 2 years. It has relatively few side effects. We usually see mild elevations in the liver enzymes, manageable lack of appetite, nausea, vomiting, diarrhea, and for a lot of dogs, these will resolve over time. If you can get through the first 3 or 4 weeks, they actually adapt to it. We see a lot of coat changes. I always list this with fluconazole, but it can occur with any of them, and that's because these drugs interfere with cholesterol synthesis, and it can affect mammalian cells, and these are involved with the softness and lack of dryness of your skin. So it dries your skin out. People get chapped lips, dry mouths, dandruffy hair, their hair falls out. And guess what? We see some of those things in dogs too. Dry, thin hair coat, dandruff, and it doesn't regrow very well. I have you combat that with fish oil, and it does help. It won't eliminate it completely, but it helps to keep their skin somewhat softer and more supple. And then we have the uncommon or idiosyncratic reactions, things that aren't entirely anticipated based on the mechanism of the drug. And that would be with fluconazole, severe liver changes are idiosyncratic. We don't see it in every dog, and we don't necessarily anticipate it. A kind of weird but not rare effect of fluconazole is it makes some dogs drink a lot of water and then they're peeing more. And mainly in spayed female dogs, then they're like leaking. The owner says, I woke up this morning and the dog's bed was wet. And they didn't have a leaking problem before. So if they need the fluconazole, we can give them a drug to address the leaking. But if the drinking urination is really severe, I usually just recommend they change the drugs. And then this is a picture of a dog with a true allergic reaction to fluconazole. He has hives in his ear. They're really easy to see here. He had hives everywhere. We changed him to itraconazole, and this all went away, and he got better. But guess what? Itraconazole can cause things too. So this drug is more potent. In a double-blind randomized study in humans, it's a much better bone drug than fluconazole. Often veterinarians may start with this drug for bone disease. If your dog goes in with a bone lesion and they recommend this drug, that's probably why. It cannot be compounded. All right, see the little beads in this capsule here? This is fixed in a special way that makes it soluble inside the GI tract. It's an extremely insoluble drug. And these dextran beads are important to this. In compounded preparations, you cannot detect any measurable blood concentrations of itraconazole if you don't use one of the commercial preparations. Luckily, it is now generic, and it's just a bit more expensive than fluconazole. And this is usually veterinarian's second-line drug for dogs that are failing fluconazole. It does have a little bit more in the way of adverse effects. I do not find that it causes more nausea, vomiting, and diarrhea, but I do see more liver enzyme problems with it. And they're often dose dependent, so I don't push the doses really high with this drug. And there's this other problem, and this is also dose dependent, but some dogs develop it no matter what, and you just have to pick a different drug. This is a pretty unique side effect to itraconazole that I've seen two with flu, out of gazillions of dogs. It's called, the underlying mechanism is vasculitis, and what it does is you literally like wake up one day and your dog's got some kind of a lesion on the skin, and they may look like a hot spot initially, a draining abscess. This dog looked like someone poured battery acid down his back end. And you can see the skin here is all like sloughed off. And this was a drug effect. We took him off this, and in a week, this was almost completely healed. So the other thing is that it only comes as a 100 milligram capsule or a low concentration liquid. So it can be a pain, but I split capsules. I have them split capsules. If your dog needs 50 milligrams, give a half a capsule, shake it out into his food. This doesn't taste bad. You can stir it into something they'll eat. And put the cap on and give the rest of it tomorrow. And this works. Clinically, it works. Pharmacologists might roll over in their grave. I have another one I use this way, and I measure the blood levels of it, and I know that this can work. So I'm comfortable with it. And then we talked briefly about these. Terbinafine is the good add-on drug for flu and for itra, inexpensive, low rate of adverse effects. Voriconazole and posaconazole are two newer and more expensive drugs for dogs that are failing itraconazole and fluconazole. And these drugs, they save lives. And they're really useful when these other three drugs won't work, because the dog's got a really resistant or really widespread infection. They both cost more, and another additional cost related to them is monitoring, which includes measuring the blood levels as well as measuring the serum chemistry things that we talked about already. But I have dogs that would be dead if we had not given them this drug. And then amphotericin B is the same way. It's usually used in life-threatening situations where you think you need something to save this dog's life quickly, or they're gonna die. And we give them these infusions, and you still follow it with oral medication. This one has a potential to harm the kidneys. And so it's used with very intensive monitoring before they get every dose of this drug. And they can only take so much of it. So they can take about 12 or 15 doses of this drug, and then we need to discontinue it. But in most cases, we've suppressed this fungus well enough by that time that their immune system and the oral drugs can keep going in healing these dogs up. This little dog was doing really badly, and we thought he needed amphotericin B infusions, and she emptied her trust fund to give him this drug and save his life, and she spent about $20,000 on it. And that was 15 years ago. So it can be hard on the checkbook, and a lot of people can't afford to give these kinds of drugs. And this is where I think voriconazole and posaconazole, the two new oral drugs, are a blessing. They're expensive, but they're much less expensive than the IV infusions. So I'm going to stop talking now about the treatment. I'm going to talk about things related to stuff we've done at the Valley Fever Center that probably will improve lives for, dogs' lives with Valley fever. We try to do research like that. It's done exclusively from donor money, and I'm really judicious with it. Like, I saved it for 15 years and then had a good study to do and ran one kind of thing. Dog owners helped pay for this Valley fever vaccine. We needed preliminary data from the original construct that we made, and we didn't have the money to do it. And we did a GoFundMe. We had people that donate regularly, we do. And then we had one donor step forward and say, tell me about your project. So I had to write it up and send it to her. She says, because if I'm interested, I'm prepared to give more. And between all those things, people in Arizona, $5, $25, $100 at a time, paid for the preliminary data that got us to where we are with the dog vaccine. We would not have had the preliminary data necessary to apply for the NIH grant that really sprung this into almost existence. So I'm going to give a vaccine update, which is a very short story. And that is, we have a vaccine. Let me see what I've got on the, I'll put the next slide up, but I will take the time to tell you where we are now. Yes. Okay. So we got our preliminary data, we got our money, we made the vaccine, which is an avirulent live vaccine. Okay, so this is giving the USDA a lot of heartburn because it's alive, right? They don't like live vaccines, they want it dead, put in a bottle. The problem with valley fever is that you can't just make an antibody and have the animal be immune to it. It doesn't work. You can't just give them a subunit vaccine. I worked on that for 15 years in mice. Yeah, we can get a couple logs reduction in the fungal burden, but you know, if you wait long enough, they die anyways. Well, this just isn't enough to spend, to make it worth spending the millions of dollars it takes to put something on the market. And then serendipitously, it's a combination of science and serendipity, we knocked a gene out that made the thing like it doesn't kill mice. It doesn't kill mice that die of all other valley fever we've ever given. It's like, well, let's see if it protects them. It's like, wow, the fungal burdens are 0. And they're not 0 in everybody, but they're under 100. And at you know, 1 million, the mice die. So this is 4 logs reduction. This is enormous. 100, your immune system can mop this up. Okay, you probably breathed it in. So the vaccine was amazing. And we went from mice into dogs. The USDA requires that you do this, a dog study that's like a mouse study. It is not optional, because I had this grand plan how to test this in community dogs and never do lab dogs, et cetera. It doesn't happen. If you're going to license it, you have to do this. So we did it. And the protection was really excellent. All of the dogs that got 2 doses of the vaccine had like minimal or no evidence of valley fever. The dogs that only got 1 dose didn't really look any better protected than the controls. They really needs 2 doses. They probably had some mild protection, but it was, I'd give my dog 2, let's put it that way. And the controls all had significant evidence of disease. And the model that we developed to study this wasn't one that's going to make dogs fall over dead. All we had to do was have measurable evidence of disease. I wanted a model that looked like the model that walks in the door. They have pneumonia, they have swollen lymph nodes, they have a fever, they have a cough. We actually had 1 dog with a cough out of a whole bunch of them. But we could x-ray their lungs, and they had measurable things we could measure quantitatively. They said, fine, that's a great model. So, and the vaccine prevented almost all of this. So you haven't looked at it in real life yet. We haven't yet. But so what happened then from there is that we were well on our way to this, and we got our grant in 2017. And then the vaccine got COVID. And this made people stay home from work. You know, we couldn't get vials to put it in. You couldn't get this, you couldn't get that. You know, the world was shut down for a year. And meanwhile, everything costs money, whether you're driving your vaccine forward or not. And things were slow to get started after the pandemic, especially the USDA. 30% of their people retired during the pandemic, and they have not been able to replace them because nobody wants to work for the USDA, I guess. So veterinary vaccines are licensed by the Center for Veterinary Biologics. And I actually went out there in March last year, and it made me roll my eyes, but whatever. They're the ones that have the last word. So there's a series of reports that are going to them for safety studies that were done last year. If they say good, there will be 1 final dog study with the final formulation vaccine Then it can be tested for safety in community dogs. And they're hoping for a release in late 25 to early 2026, but don't hold me to it. Clearly, you can see that a lot of it's out of our hands. And then we have an ongoing study at the university called the WOOF study. And this is designed to be user-friendly by dog owners because veterinarians are too busy to work with us on these studies. It's like, well, shoot, with the internet, let's use owners. So we wanted to understand what is the primary diagnosis in dogs and what's the outcome of new onset valley fever. So the dogs have to be within 30 days of diagnosis when they enroll. We also were hoping to get some information out of places other than Arizona, because we have a lot of Arizona information, but what's it like in California or Texas or Nevada? Well, not much, apparently, because we don't get any enrollment. But this has worked very well as a platform. It's all on a HIPAA-protected database, so it's good. It sends out your survey when you're due for your next one. We want to get 500 cases. And we currently have, Dr. Bukevich updated this for me, 202, we have 202 dogs in it. That's on the next slide. So this slide, I'm not going to go over very much. If you're interested, you can go to the website, and there's a QR code on one of the slides that you can just take a picture of it and go find it. But all of this is done through the owner. And then what we've got right now at a 202 dogs, we'll just run it either till we get tired of it or run out of money or we get 500 dogs. But most of the dogs are mixed breed dogs, which is characteristic of our general dog population. Labs and Goldens are the most common purebreds. Well, that's because they're the most common dogs. And they're big. Valley fever is overrepresented in bigger dogs. They're probably outdoors running around doing dog things more. And the average age is 5 years, which actually in every study that has ever been published, the average age is about 5 years when they get it. And 88% of the dogs are from Arizona. These are the clinical signs in the pie chart. It's kind of fun to look at this. And actually, if your dog's enrolled in the study, you can pull these things up and look at them and see how it's looking like. But most dogs are presented with lethargy and tiredness, lack of energy is big. And then the other symptoms, coughing, fever, etc., you can see they're of lower rates. And the dogs have more than one symptom frequently when they go to the vet. So it's just what they report. On the left is titers. And this is at initial diagnosis. And what you can see is they're all over the place, including negative. Dogs may have a lot of signs, blood work and x-rays that support a diagnosis of valley fever, but the titer's negative. Veterinarians in Arizona are pretty savvy, and they're going to go, I really think your dog has valley fever and we should try some fluconazole. And often they're right. But as you can see, how high the titer is doesn't tell you anything. They're all over the place. And most of them are low or moderate. And then treatment observations so far is that almost all of the dogs are started on fluconazole initially. So this is not just something I say, this is what veterinarians are doing. And out of the dogs that have been in the study, about 10% of them have required a medication change, usually to itraconazole. And it looks like the veterinarians gave those dogs 1 to 3 months before they changed the medication if they weren't responding, because three-quarters of them had a medication change in those first 3 months of treatment. And out of those, almost 70% were changed because the dog failed to improve. And my one little sidebar over here is that out of a set of 540 clinical samples tested at University of Texas Health Sciences in San Antonio, about 30% of human valley fever isolates that are isolated from patients are not very sensitive to fluconazole. And this data in dogs would actually correlate with that pretty well. And then I just want to say thank you very much for coming, all of you, including our online guests. There's the QR code for the study, though I actually hope that nobody here needs it. And then I did put a little yellow thing in here about how you can support the canine research if you're interested. If you go to the website, you donate to the Companion Care Fund. And all of that money goes to research for companion animals. And I would be very happy to answer questions. We'll answer questions from the floor, and then we have possibly some questions that were emailed in ahead of time, and there might be room for some questions from the chat box. But let's go with questions.
So everything that you say about dogs and the dirt and the dust and digging, and how do they not get valley fever? Because my dogs meet all of the characteristics where we live, and only one had valley fever. And so now we have new dogs, and none of them have gotten valley fever.
That's good. You probably live in an area where the incidence is relatively low. I've had a couple people sell their house over the years because every dog they brought in gets valley fever, and it's probably deeply entrenched in their soil, and all of their dogs are getting exposed. So it could be variable. Also, not every dog that gets valley fever that gets sick, and that's true of humans also. Many of us have had valley fever, and we don't know we had valley fever. I mean, it came and it went, and it never even made us sick. That's true of dogs. And in research that we did between 2000 and 2003, we showed that about 70% of dogs, we could actually detect a titer, and there might be even more that never have a detectable titer. Detected a titer and it went away, and the dog never got sick over the 2 years that we followed them. So like humans, I think that a large number of dogs may actually become infected. They inhaled one spore. Their immune system said, aha, I got it. And they prevent all the other spores that they ever breathe in from making them sick. Okay, so that might be one, and that may be there may be a dose effect to that. They may get a spore and they only got one, but the dog 25 miles away that lives on the edge of the wash somewhere gets 100 or 1,000 or whatever and gets sick. And maybe they're all exposed at that level, and so all their dogs. There are probably some genetic predispositions, and we don't know what they are. My dream research project would be to look for genetic determinants of severe valley fever in dogs. It's not going to happen in my lifetime, maybe someone else's.
For no reason to have them tested if they're not showing any kind of symptoms.
Not necessarily, unless you're like the person that every dog that they bring on their property gets valley fever. I remember working with a breeder one time that she bred Irish wolfhounds, and she no longer does, but her piece of property was probably heavily infected. It's a big dog. You're going to be raising puppies more in an outdoor environment than in your living room. If you have papillons, they're probably in the house. And they did test every single puppy. And they had a plan. They were working with their veterinarian to try to tamp this down right away and identify who was sick. Because these dogs would go all over the country. You send it to New York and nobody knows what it is, and it's dead before they figure it out. So, but generally, no. I don't recommend testing healthy dogs unless you have a reason to test a healthy dog. And I don't know what else I was going to say about that. Did I answer your question? And also, you've got ground cover, so that can help too. Yes, I will. So what ground cover does is it helps reduce dust. And again, we talked about the fact that breathing is a risk factor. You can't not breathe. We can't eradicate it completely from our environment. But ground cover helps to reduce the amount of it that gets into the air. It might prevent them from digging. It might discourage rodents that we talked about their role in this. And so gravel, hardscape, which I personally hate, and it's really hot out here. Grass, which we can't afford for a lot of reasons in our particular environment. It's almost impossible for people to maintain grass. You could probably put down an artificial grass, and that would really keep them away from it, keep separated from it. And that's about what you can do for ground cover. I tell people they can move. So, someplace where it doesn't live. I mean, it's true, but we've most of us lived here for a long time with it anyway, and just live with it. So ground cover can help because it reduces dust.
There's recent cases in the past years of more dogs contracting valley fever. I've had 4 in a year and a half.
It probably goes up and down year to year, and human cases are very much up in 2024. I don't have the final stats on them yet, but my boss keeps track. Yes, the simple answer is yes. It may be hotter, it may be drier. Well, we know it's hotter and drier. The fungus is doing really well despite the hot and the dry. And there's a tremendous amount of construction and disruption of natural soil that's never been built on before. If you walk your dog at Reed Park, they're probably not going to get sick. If you walk your dog in the Tucson Mountains and they're building houses and apartments, there's a more likelihood of them getting sick. We showed that walking on sidewalks and in parks was protective against detecting the serological positive.
Near the wash.
If you walked on the paved path, I would think, and you don't have a flexi line and they're going and checking out all the road holes on the side, it's probably good.
What's the incubation period?
They say 1 to 3 weeks, but I think it could even be a little bit longer in dogs for reasons I don't have time to explain. But certainly within 1 to 3 weeks of exposure, they might get enough reproduction of the fungus to develop some signs of coughing.
My question is on compounded fluconazole. I have a dog that has valley fever that her titer doubled in 2 months of being on compounded fluconazole. And so they took her off it and we went on, it's because she was in between the weight thing and that's why they did that. We put it on the higher dose of regular fluconazole and now we're seeing it go down. So is there an issue with compounded?
Potentially there is. It's not regulated in terms of quality control the way an FDA approved generic is. So if it's affordable, we recommend people try to use a commercial medication. And right now, I don't think there's that much benefit. I've had people come in and tell me what they're paying, and I tell them to get a good RX card and go to the pharmacy. And they're, wow, that was less. And they're using a commercial product. So I would avoid it. Itraconazole can't be. People might be compounding voriconazole because it's still pretty expensive. POSA not, and it's not necessary. I can usually help people a lot with the costs of posaconazole in various creative ways. Yes.
Is there any studies saying that more malnourished dogs get it easier, and the question, I guess I'm asking that is because I'm wondering if there's some nutraceuticals or that can help prevent?
None that I know of. That being said, the sickest dogs I see come out of pack. They have been potentially stray or neglected. Most of them are malnourished. They have multi-site disease. It's usually in many places. They're really sick, like the dog I showed you the picture of. That was a pack dog. And she said when it came in, it was almost dead. That was a year later, and he still got, osteomyelitis and 10 bones and no ribs. And so there, I'm sure there is a connection, but it's not something that has been quantitated. So there were a few questions that came in online that seemed good to address. Are there any on that list that we haven't already addressed from questions in the room?
Yes, there was one about the fact that the spore is found in the soil. Is it okay to give a soil-based probiotic?
I will answer that question. It's an odd question, and I don't know how many people are using soil-based probiotics, but the simple answer to that question is yes, because they're probably not harvesting any of those probiotics from this desert soil. And the environment in which Coxie lives is pretty specific to our area, to the dryness, to the rodent population. And I guess unless you're going out to the rodent burrows and scooping up dirt and, filtering it and giving it to your dog, probably not. Also, it's normally inhaled. There is no evidence that it can be acquired by ingestion.
once your dog is diagnosed, what do you suggest as far as following up with retesting for valley fever, and if when they're on fluconazole, following up for the liver?
This is a good question.
blood test?
So my plan with my clients, and I talk to veterinarians a lot, so this is what I recommend they do, is that they bring the dog back in at a month after starting the medication to test the liver enzymes. And this gives them time to settle down and see if they're going to adapt to it, or gives them time to start to go up so that they can make a decision as to whether or not that needs to happen. Also, the dogs are sick. It's really good to put eyes back on these dogs in a month. Most of them don't need new x-rays unless they are doing worse, and then they might recommend additional diagnostics. But if they're doing better, they're going to probably check your serum chemistries and CBC again if there are any abnormalities. They're going to check the serum chemistries for the liver and make sure things are going well. And then it might be 2 or 3 months before they have you come back in again. And at that time, they might run an additional titer. And after that, most veterinarians are going to recommend a checkup every 3 to 6 months as the dog is doing well, especially as they stabilize and if their liver enzymes are good and you're not having any problems. Dogs that are not getting better are probably going to have to come in for rechecks every month to 6 weeks to make sure that they don't start going downhill. I've also seen dogs that the veterinarian gave them a prescription of fluconazole and said, see you in 6 months. The dog was doing horribly. In 6 months, he was almost dead from disseminated valley fever because they said, see you in 6 months. So early follow-up is important. And as they're doing better, those rechecks can usually be stretched out. And I think the majority of veterinarians in our area make good recommendations for follow-up care. Other than, sometimes I don't run titers as much anymore as I used to. Like if I can do a lung x-ray or a titer for financial reasons, and it's been 3 months and the dog had abnormal lungs, I'm going to check his lung x-ray because I don't really care what his titer is. If it's 1 to 2, I'm not changing anything if he's still got, pneumonia in his lungs. So those are things that they would do. And recommending recheck x-rays at 2 to 3 months is a very reasonable thing to do for lung disease. Did we have any further questions on the chat? Yes, back row.
Okay. If a dog has valley fever in their heart, what would be like symptoms or tells that like their heart murmur be something, or is that completely?
So the most common reason a heart murmur is not usually detected. Usually the dog is brought in because their energy is deteriorated. When the vet listens to the heart, they might hear a muffled heart sound because it would be like it's beating underwater because there's fluid around the lungs. Or the most common ones that I have seen, they come in because they've got fluid around their lungs or they've got fluid in their abdomen because the heart isn't working and the fluid's backing up. The valley fever is not in the around the lungs, it's not in the abdomen necessarily, but it's in this lining of the heart, and the heart can't pump against it, so it's building up fluid the same way as if it was an old dog in heart failure. So they come in heart failure. And it's like, you don't really expect a 2-year-old dog with heart failure. It can be detected primarily by ultrasound. If they take an x-ray, the heart might be big. And they go, wow, that heart's really big. Maybe we should ultrasound it. And it might be also found at initial diagnosis because the dog's coughing and the heart's pushing on the trachea. And the heart's, the size of a water balloon. You put an ultrasound machine on it, there's fluid in it. It can be tapped. Or they might just it may be tapped so the dog's heart can beat, but they're also going to send out blood work to look for cocci. Again, awareness of this has increased greatly out here. And this is not rare. There is a paper of 18 cases that came out of Phoenix about 10 years ago. So it is something that needs to be kept an eye on. I believe we have somebody here whose dog died from this disease.
My dog had gotten valley fever, came back from Rocky Point. His stomach was swollen, so we took him in and ended up he had valley fever of the heart. So they removed the pericardial sac, and at one point it was very low in potassium, so the vet there saved his life on that part. And then saw a cardiologist, no problem, But then a year and a half later, died in his sleep.
So I think what
Drains your bank account, but
does, I think what happens, and we don't, there's a little literature on this, mostly because I dug it out of the diagnostic lab at the University of Arizona. And that is, I think that these dogs get scarring of the heart muscle too, like having a heart attack. And I think that's what happens to these dogs that are doing well from during, after this condition, is they've actually got a scar. It gets in the conduction system, and they literally can be running around the backyard and drop dead. Wake up, find them dead. And we usually don't necropsy those dogs, and you'd probably have to slice the whole heart. But my guess is if you could actually do that, you would find they've got scarring in the conduction fibers.
he just died in his sleep. No seizure.
Yeah.
Curled up, you could tell the heart just quit.
I think that's probably what happened, and I've had it happen to a few other dogs that were also like doing well and then died.
Okay, so we have a question online, which is, what are the current treatment guidelines once a negative valley fever titer has been achieved? And do you recommend the dog stay on a low dose of antifungal for the rest of its life?
That's a great question. It is, it's kind of gray. This is never a one size fits all answer. But my current approach is that when we take the dogs off medication, and again, I see complicated cases. They've come because something isn't going right. And if we get them to the point where we can take them off the medication, I usually have them come in every 3 months for a full year. So they're going to get 4 tests in the next year for a valley fever titer. And if it climbs 2 dilutions, we talk about whether we should try that dog back on antifungal medication for another several months, or whether the dog is otherwise really doing great. We might do further evaluations, run some extra blood work before deciding to put him back on the medication. And after they've reached that, the farther out they get from their illness and their stopping treatment, the less likelihood there is that the valley fever will recur, but it is never zero. Basically, the owner of a dog that had valley fever and isn't being treated anymore will be alert for the rest of that dog's life, and probably bring them to the vet sooner rather than later to have them evaluated for whether or not the disease is coming back. It's just a bad problem with the fungus. And this is true in people also. But the farther out you get, the less likely it is to recur. And at a year, I tell them, you can come in every 6 months or annually and have this tested. You can go back to your regular vet. You can never test it again. I have dogs that come back for the rest of their life sometimes, but a lot of them, they just drift away back to their regular vet once they're comfortable and they're not so worried about the valley fever coming back. And the second part of that question was to do with fluconazole maintenance. Is that right? So some dogs will get to the point where they've been months or years with no clinical signs of disease, but their dogs, like maybe they had brain disease, or maybe they've already had their second recurrence. It was treated, stopped, came back, treated, or it came back really bad when it came back. These owners are very risk averse. They don't really want the dogs off medication. They don't want them on the medication either. They just don't want to do the valley fever again. And what I usually do with these dogs is reduce their medication to a maintenance once a day dose. And it's usually about 25%, but not less than 5 milligrams per kilogram of what they took initially. But this may vary by veterinarian, and other veterinarians may have, an algorithm that they use for doing this and reduce them to maintenance doses. But often these dogs can survive with a lower dose of the antifungal medication to keep the disease in check, since we know we can't get rid of it in this dog, than takes to treat it. And what we're doing is we're just reminding the fungus to stay where it's supposed to be, walled off, and not come blasting back and kill the dog. So that was a good question.
My sister's.
I'm sorry, hang on. You couldn't see, there's a lady behind you.
Cowboy is in the WOOF study. He's a pack dog, and he's not neutered. And now he's on close to carnival, which we've gotten down to $4 a pill.
Yeah.
But, Dr. Hillis recommended not neutering him. He has a little bit of a hard place in his scrotum, and he also said that it could hide there. Can you explain?
Is he stable enough to neuter?
That's what we're trying to find out.
Okay.
When is stable enough? I mean,
Well, I like him to not have lung disease anymore.
so he,
Like I think they're a good anesthetic risk because you know they don't have pneumonia anymore, and they could have it. And also neutering him would probably get rid of that nidus
okay.
if he's got a possible lesion in the
We just have to
testicle.
have that listen to his lungs and then figure out.
I'd take a lung X-ray if it was my dog. So yes,
Isn't there a study currently going on about the blood titer in different labs, and
yes,
is that done yet? Or
it is done.
results?
It is done, and we are working on the paper for that. You don't want the answer. There is tremendous inter-lab variability in titers. If you're using one lab for your titers, make sure that your follow-up titers go to the same lab. Okay, they vary dramatically, and it's not something we can do anything about with the test that is currently used by commercial laboratories for serology. What we need is a better test that is more mechanized and uses more defined reagents on the front end. And that's probably as much as I could tell you without giving you a half an hour dissertation on how we run valley fever tests. But I thank you for asking that question. I didn't think I would have time to present it here, so we didn't, but yes, it's a good study.
Do you know if DNA is affected by valley fever?
I don't know.
Don't.
No, don't know. I would think not, but I mean, it's not a virus where it can worm its way into your DNA. Are there epigenetic changes that dogs have that would make the next generation less likely to get it? Because they're not going to be DNA changes. We're pretty sure of that. And epigenetics is a whole emerging field, but there are changes that probably allow for faster non-DNA based local adaptations to problems. The other thing is valley fever is a eukaryotic organism. It's more closely related to a dog or a mammal than it is to a bacteria or a virus. It has 6 chromosomes. It's a very complicated organism, and this is why it's hard to make a vaccine for it. But it's not interested in our DNA. It just wants to do its own thing. And it has a very sophisticated system for surviving in us and making sure it gets to complete its life cycle in the dirt, back and forth between mammals and soil. And we're a little bit incidental. Any old mammal will do. So we have one more question.
Will more exposure to the fungus cause the treatment to be more difficult and you get re-exposed when you treatment?
That's a very difficult question to answer. There's probably no real data. We are probably re-exposed all the time. Whether re-exposure makes treatment more difficult is a question I cannot answer. I don't actually know. I mean, I guess you could try infecting some dogs in Tucson and keep giving them more spores and then take them to Canada and find out if they all get better really fast compared to dogs left in Arizona.
So if I move, she'll be not.
I don't know. She won't be exposed. She won't get more exposed. The question is, what does the body do with new arthroconidia that are inhaled? The evidence in mice, which by the way are really susceptible, is that probably when you give more spores, your lung takes care of them immediately. And what you're dealing with is what's already inside you, not the new stuff that comes in, because you got tools that are like Pac-Man in there, waiting for new ones to come in and going, I gotcha. But when the first ones come in, it doesn't know what to do with it. And the fungus uses a lot of mechanisms to evade being killed by our immune cells that are able to naturally kill most pathogens, or we'd all be dead. You know, everything's a pathogen and our lungs get exposed. And we'd all be dead if our bodies weren't really good at doing this. But valley fever says, oh, I've got some tools that, I mean, that's the difference between a pathogen and a non-pathogen. The pathogens figured out how to work around those things. And when it gets inside you, it doesn't grow on the surfaces of your lung. It grows inside the cells. So it's underneath those airways. But the airway mechanisms that are developed from learning how to manage the pathogen will prevent new ones from coming in. And I did this experiment once in mice. I gave them a strain we have that won't kill them. And I followed it with a strain we have that will kill them. And we couldn't find the will kill them strain. So basically the one infection protected them from a follow-up infection that should have killed them. And we had the strain marked so we could find it.
Last question.
Yes.
This came in from online. Is it not wise to vaccinate dogs who have valley fever?
My personal opinion is their immune systems don't need to be challenged with any more things while they're in the throes of being really sick with valley fever. Once they've stabilized and they're pretty healthy, even though they're still on antifungal medication. I mean, an owner comes in and says, my dog needs a rabies shot. Can I have one? I tell them, go do what you need. Go do what you need to do. When they're running a fever and things like that, and they're coughing, I guess I just don't think they need to be challenged with that. But opinions may vary on that, and I can't say that I have evidence to prove that they shouldn't be vaccinated. Their immune systems are busy. I don't know what it'll do to the vaccine. And some of them may be on steroids, so that'll suppress the vaccine response. Okay.
All right.
Thank you.
So much.